Hello and welcome to this live interaction on News9's YouTube and Facebook page. I am Prajwal D'Souza. Do you know that around 30% of the COVID-19 patients in intensive care units of hospitals are young people below the age of 40? Now, this is what top doctors of Mumbai have said. The doctors have said that there has been a rise of 34% in such cases only in the past month. Now, several hospitals in Mumbai have released several data which clearly indicate a pattern in Mumbai, where 25% of the patients belong to the category below 40. Now in Fortis, Mumbai and Bombay Hospital, the figures stand at 16 and 30%. Now, younger people who have symptoms of COVID-19 are largely choosing to self-medicate instead of visiting a doctor and are later approaching hospitals with several complications. Now, out of the total COVID-19 tally in India, around 31.15% of COVID-19 patients are young people. Now, they also comprise of people who have succumbed to COVID-19. Now, to discuss the issue further, I am joined by Dr. Sitesh Roy, an immunologist from Mumbai. Now, Dr. Roy, thank you for joining us. Dr. Roy, why do you think there is a surge of young COVID-19 patients in Mumbai?
So Prajwal, this is again a multifactorial reason why this is happening.
Yes.
The biggest reason I believe is the fact that it has been so publicized that COVID-19 worst affects people above the age of 50.
Yes.
And they are the people who are at highest risk for it. And that I think that many young people are not really taking the precautions that they should take with the unlock in progress. And as people have started going back to work, travel, probably some of the entertainment areas also opening up.
Yes.
There is an increased risk to everyone of all ages. And if the younger generation, the younger people or those below 40 are not wearing their mask, not physically distancing, not using their hand washing techniques and maintaining their cough hygiene, it's very, very likely that these cases will increase or progress over time. So I think that there is some degree of laxity or some degree of complacency amongst the younger people because they believe that even if they got the SARS-CoV-2 virus, they would be unaffected by it or they would be only mildly affected, and they are taken by surprise when sometimes the virus does get.
Yes.
And when we look at the fatality rates in India, about 4.5% of deaths have been in people below the age of 40.
Yes,
so
yes.
I think that this is a very important message for people to recognize that you can't take this virus lightly. You have to take care of yourself.
Yes. Now, doctor, several doctors in Mumbai have said that a lot of these young people are choosing to self-medicate. Now, according to you, what are the complications of self-medicating?
So, whenever self-medication is done, the most significant complication would be the progression of the disease, where the person themselves does not know that the disease is progressing. So, for example, paracetamol, which is a well-publicized medicine for fever, has been used for the longest period of time. A person may take 3-4 paracetamols in a day and control their fever while their breathing issues or their lung issues may still progress. And when such things happen, or they could just go from having a mild disease to a moderate disease where they may require hospitalization, they may require oxygen. And in the worst case scenario, if they get a complication due to the disease, where they do have to go on oxygen, go on a ventilator, go into an ICU, there have been quite a few young people who have developed cardiac problems, including heart attacks or having blood vessel occlusion due to the thromboembolism or microcoagulopathy that occurs with COVID-19 infection. And so even young people are at risk for these kind of complications, which can ultimately lead to ICU admission, hospitalization, as well as even organ damage.
Yes. Now, doctor, do you think we are witnessing a change in pattern where, young people are getting infected more than old people? Do you think this is because the easing of the lockdown?
There is definitely a contribution because, as we would expect, the elderly individuals or the senior citizens of India have been told again and again that they need to stay inside, they need to keep themselves safe. So they are probably not traveling as much. But the younger generation definitely has to go back to work. They have to earn their livelihood for themselves and their families. And with certain areas, public transportation, for example, buses have been running in Mumbai for a while now. Trains are still stopped, which is a good thing because anywhere where there is crowding, where there are people together in a closed or enclosed space,
Yes.
the chance of transmission is high.
Yes.
Similarly, if you take with the marketplaces opening and certain consideration of other areas also where people can get together opening, it's a concern that the young people, as they become more mobile and go out of their houses, they can actually catch the infection and unfortunately also bring it back home and give it to their parents, grandparents, and other people at home, which is what we see as the cluster cases within families that we so commonly see.
So, Doctor, what is your message to all the young people who are watching this interaction right now, Doctor?
The biggest message is recognize that nobody is immune to this virus right now. Even the person who has had an infection can get it again. The virus has shown that to us.
Yes.
So there have been top class tennis stars, there have been baseball players, football players, there have been athletes who have gotten sick who are in the prime of their health.
Yes.
And working out. So what youngsters have to realize is that they have to respect the times.
Yes.
They have to wear their mask and wear it correctly over their nose, not below their nose or on their chin. They need to wear it whenever they are around other people, even
Yes,
if it is one other person whom they know very well.
Yes.
They should still wear their mask because masks do save lives. And if 90% of India started wearing the mask, we would curb the stem the tide of cases we are seeing. The second is hand washing, hand sanitizing whenever you're touching any surfaces that are commonly used by more than one people. And then the last one would be physical distancing where practical and possible, and also making sure that you are maintaining what is called respiratory and cough hygiene, not coughing in open, not sneezing in open, trying to cover yourself
Yes.
properly if anytime something like that happens. So if all of these precautions are taken, I believe the younger generation can also stay safe and continue to work and do what they need to do while staying protected.
Yes, absolutely, absolutely. Thank you very much, Dr. Roy, for joining us on this live interaction. Now, as Dr. Roy has clearly said, young people may think that they are, safe from this virus, but they are actually very much exposed and vulnerable to getting infected by the virus. Hence, I again urge you to wear mask, maintain social distancing, and if you have any symptoms, it's better to go to a doctor and never self-medicate. Now, on that note, thank you for joining me on this live interaction. If you like this video, click on the like button and don't forget to subscribe to News9 Digital on all the social media platforms. Thank you for watching and stay safe.